did some research about breathing and moisture loss, dehydration, and ENS, empty nose syndrome. And so at night, when we sleeping, we lose moisture by breathing and by sweating. So if we live in a room, a cold room, it's better, not sweating, just through the breathing. So since at night we're not drinking water and when we're sleeping, so our body just constantly losing water, and the result will be our blood will lose water and mainly in the plasma, so our blood kind of getting sicker. And as some friends mentioned that you lose blood, actually it does happen. You probably lose couple percentage can be through the night, 1% or 2%. So when we lose the blood percentage, that can cause kind of mild or medium dehydration. So when that happen, and if affect our brain, because brain has around 70 or some kind of moisture content. Of course, it affect our lung. Our lung has 83% of moisture and affect all the other organs. So we can feel dizzy, we can feel headache, and all the blood pressure can be dropping because we don't have enough blood and heart rate pumping. You get a heart rate pumping. And for the ENS, empty nose syndrome, since the nose open and you get more shallow breathing. You don't have the deep breathing, so the shallow breathing will make the breathing oxygen less, and also the breathing less efficient, and in that breathing and lose more moisture. Yeah, that's why friends like in the YouTube peppermint friend, they said dry nose and dry lung. So basically you lost a lot of the moisture through the night sleeping. So that's why in the morning time when you open up, you get extremely dry on the nose, dry in the mouth, and even dry in the lung. And I think this dryness or dehydration systematically, long time, it can hurting our brain, cognitive, and like we didn't saw it clearly because the brain lost the moisture. Blood is sicker, they cannot transfer to the different organ. It definitely hurting the kidney. So the key is how to decrease the moisture loss and decrease the dehydration for the ENS. And we mentioned about this nose cap help decrease moisture loss. So that potentially will help the dehydration. So if every night this cap can save us around 200 grams water, half pounds of water. That's tremendously for the blood, percentage of the blood. So that would be a big help for dehydration. That would be a big help for maintain the brain function, maintain the all different organ function, and potentially be a big help for the ENS friends. And it's not a one-day thing. You every day you accumulate all these functions, and eventually we will help us kind of recover, get the body recover. So this a little nose cap or nose mask may potentially do that job, and it can be a very simple concept about if you have a cup of water, if you have the water there, the water can evaporate by naturally evaporation. When we're breathing, it's even worse because you get air constantly blow there and take away the moisture. So if we have this cap, if you put even layers of paper on it, the water will leave in much slower. So this cap depend on different materials, so you can really regulate the water, so don't let it leave. I think this nose cap, wear this nose cap sleeping, can be a help. And when you're sleeping, you really not interfere with anything. And of course, you try to stop your mouth breathing, try to avoid your mouth breathing. If your nose cannot nose breathing, use through the mouth breathing. You just make one cover both mouth and nose. So in that way, you will continue to decrease the moisture loss and to lead to dehydration. So let's see, and we'll hopefully learn more about it. And hydration, the water is the key. Water is life. You see, the air is life, and water is life, and the oxygen is life. All the element, the key element, if we are not in balance, and because that affects us every second. When we're breathing, it affects that concentration. So accumulated by the time, months, it can affect our health. And this little cap, it stay on. When you're sleeping, it doesn't falling off. And the medical adhesive feel airtight seal. It seal really good. So I do karate and running, jogging. It hug you good, it's not falling off. So through the night, nobody look at you, so you'll not feel embarrassing. And by wear that, but through the night, the dehydration is most critical, because when we're sleeping, we cannot drink water. That's why in the early morning is our body dehydration the most. Through the day, we can constantly get water in. And at night is very critical. So at night, and that's the time people don't concern to wear a nose cap, because nobody look at you. And I think the nose cap can potentially be a sleeping therapy or sleeping assistant device to make you sleeping better by decrease the moisture loss. Yeah, that's the third video we make today for the ENS topic.